This is TVN, your Township Video News Program, brought to you by PSATs, updating you on township-related news and statewide initiatives.
Hello, and thanks for tuning in to our very first Township Video News Special Report. I'm Dave Sanko, your host and Executive Director of the Pennsylvania State Association of Township Supervisors. Communities in every part of Pennsylvania are facing a problem that can't be ignored. Heroin has reemerged as the drug of choice. It's cheap. Cheaper than a six-pack of beer, easy to find, and even easier to get hooked on. In 2011, the National Institute on Drug Abuse estimated that 4.2 million Americans ages 12 and older had used heroin at least once in their lives. Another report indicates that 80% of the heroin addicts can trace their addiction back to prescription painkillers. But the story doesn't end there. Heroin is an equal opportunity destroyer, killing kids, parents, siblings, grandparents in small towns and big cities. And the overdose numbers continue to soar. In 2014, opioids, like heroin, killed at least 1,300 Pennsylvanians. Today, in fact, it's more common to die from an overdose than a car accident. Township supervisors, police, and emergency responders are among those looking for answers to an epidemic that has turned into a public health and safety nightmare. Joining me today to address the problems and solutions is a distinguished panel. Trooper Adam Reed of the Pennsylvania State Police, Senator Eugene Yaw, Board Chair of the Center for Rural Pennsylvania, which has conducted statewide hearings on heroin addiction and pushed for legislation to combat the problem. Recently, Senator Yaw was also named the 2015 Legislator of the Year for raising awareness about heroin. And finally, Barbara Lyons, Chair of the Doylestown Township Board of Supervisors in Bucks County, a group of local leaders who are addressing the heroin epidemic head-on. Welcome, everyone. Let's start off with Trooper Reed. Could you give us an overview of what heroin in Pennsylvania is and the impact it's having on our communities?
Sure thing. Thanks, Dave. Quite frankly, heroin is an epidemic right now in Pennsylvania. It's claiming many lives due to overdoses, and it's highly available. So those things as a whole are a bad combination. It's cheap, and it also transcends boundaries. And what I mean by that is it transcends racial and economic lines. So there's no set population that is not immune to this epidemic right now. There are many people that are hooked on heroin, and quite frankly, it is an epidemic. What makes heroin so dangerous is that it is so easy to get addicted to, and once you do get addicted to it, quite frankly, it's a cycle of crime. Many burglaries and other petty crimes are caused by people needing money to fuel their heroin addiction.
Senator Yaw, the board and the staff at the Center for Rural Pennsylvania have done an incredible amount of research on Pennsylvania's heroin epidemic. Can you tell us what you've learned and at the hearings and from families who've lost loved ones to addiction?
Well, I mean, what we've learned, you said it in your opening, Trooper Reed said it, it's a problem throughout Pennsylvania. I mean, it is, there are 7 people going to die today of a drug overdose in Pennsylvania every day. So it is a problem and it crosses all ages, all socioeconomic groups, everybody. It's something that we have to get our hands around. And one thing we learned, if there is a couple of things out of this report, our system is very fragmented. We need to bring it together. It's a community-wide effort forever. That is the only way we're going to treat this.
Okay. Barbara, heroin has killed young people in your township and neighboring communities. As a local leader, what's it like to hear that news, and why have you chosen to speak out about it?
It's so sad, Dave. And what Senator Yaw has said is evidence in Doylestown Township. In 2014, there were 2 deaths from heroin overdose and 1 additional overdose. And in 2015, so far this year, we've had 8 overdoses, 1 resulting in death. And Doylestown Township in Central Bucks County is what you would call a healthy community. It's got great schools, it's got all kinds of human resources available, you got attentive parents, you got fairly well-educated parents, and still we have heroin addiction in Doylestown Township. We decided to talk about it and talk loudly about it because everyone thinks it's not going to happen here. But it is happening here, and it's happening in every community in Pennsylvania. And we believe that local government, being the front lines, can have something to say about it and something to do about it.
Okay. Trooper Reed, heroin's been around for a long time. It seems to be making a comeback lately. What's fueling that, and how is this drug finding its way into small-town Pennsylvania?
Well, it's finding its way into small-town Pennsylvania in a variety of ways. First and foremost, it's coming from out of the country. It's coming from Mexican cartels, first and foremost, making its way across our border and up into the major cities of Pennsylvania, and from its major cities out into the suburban areas, and from the suburban areas out into the more rural areas of the country. So here in Pennsylvania, with its location close to many major cities in Philadelphia and Pittsburgh, in Pennsylvania there are certainly plenty of routes and plenty of sources for heroin to make its way into small-town Pennsylvania. It's gaining popularity and it's making a comeback, as we mentioned before, at the cheap price. Most recently, it was right around $10 for a small bag of heroin. That small bag of heroin is good for about a 5-hour high. So people need to keep fueling that cycle of heroin, so they're doing whatever it takes to get the money to keep feeding that habit. And as you get more addicted to heroin, you do more and more, you build a tolerance to it. So it takes more of the drug to keep up that high that you're so used to having.
Senator, in a recent interview, you had said that Pennsylvania needs to do more. What do you think that is, and what should we be expecting from Harrisburg?
It's amazing that in medical schools, we learned early on that there's more attention to pain management in veterinarians than medical doctors receive. So we've looked at it, and that's something that we could do. And as already been noted here, about 80% of the people that end up on heroin start by abusing prescription drugs. So there's obviously a connection with the medical field that we really have to address. So those are some of the things. The other thing to be, I hate to raise it at this time, but we probably need to focus more money on it in helping communities come together. As I said, it takes a community-wide effort. That's the only thing that's going to ever help to address this problem.
Barbara, Doylestown Township is refusing to back down from heroin. What steps are you as a community taking, as a senator referenced, community needs to step up, and as a local leader to fight and combat the problem?
Well, it starts with our Board of Supervisors. We recognize that one of our chartering responsibilities is to provide and promote the public health of our residents and the welfare of our residents. And so from there we said, you know, this is our responsibility to make our residents aware of what the danger is, what's lurking, what resources are available in our community, where to go for help. And we partner with our local district attorney's office, of course with our police department, and other organizations in the community, the Bucks County Drug and Alcohol Commission, the Southeastern Council for Drug and Alcohol, CB Cares Educational Foundation. These organizations come together and help us get us the information and help us disseminate it. We have a website, we have a newsletter, we have DTV, which is our local cable station. We use all these communication vehicles to spread the word. We have on our website information, links to all the useful and helpful resources that parents can look to see what's going on, what I need something for my child, I need to know who to call. Those are links that we provide. Knowing that 60% of all drug deaths start with opiate use, we want our parents to know that these medicines are in the cabinets, and when the kids are going to a fishbowl party, they're using these opiates and other prescription drugs in their, at these parties. So we very much support drug take-back events in our community, where the police monitor and take back the drugs from residential homes, so that they can't be put into in the mainstream use and or also into our water supply. Then we support Narcan use and training, and we participate in town meetings. We've had Representative Marguerite Quinn from the 143rd has hosted various seminars. We broadcast also a movie called Anonymous People, which is about removing the stigma and supporting recovery. I think one of the most important things that we can do as local leaders and in Pennsylvania is to stop the idea that drug addiction is a failing of the human character. It is actually a failing of the brain chemistry. And I think we have to change that approach and that attitude.
Trooper Reed, state and local police officers as well as other first responders are starting to carry Naloxone, which is also, I guess, known as Narcan, as an anti-reversing type of drug. Can you tell us why that signals a turning point in the war, and what other tools are law enforcement using to help not only stop the distribution but the use of heroin?
Sure. Naloxone is another tool that's available to law enforcement to reverse heroin overdoses and to save lives. I brought a kit here with me today. It's a nasal spray that the Pennsylvania State Police uses. We have one of these kits available in each one of our cars. On a very basic level, if we encounter an individual who has clearly overdosed on heroin and is near death and unconscious, we administer the nasal spray, and it almost instantly reverses the effects of the heroin overdose. So this is one of the tools that we use, and it's important for law enforcement to have this at our disposal because, quite frankly, it does save lives. Other routes that law enforcement is taking to combat this epidemic is education. Education is important, whether it's in our schools or at community events. Getting out and speaking to the public, students, about the dangers of drug addiction, especially heroin, is very important. I know last year the Pennsylvania State Police conducted over 5,000 educational programs throughout the state on different crime prevention topics, one of the main ones being drug awareness and the dangers of different drugs and heroin. Another important avenue for law enforcement to take is cooperation with our other law enforcement partners, whether it's federal agencies, other state agencies, or at the local level with local police departments. That is all very important. We share information and we work together to find heroin and other dangerous drugs before it makes its way onto our streets and into small town Pennsylvania. So those are some of the main avenues that law enforcement is taking and some of the important ways that we're fighting this problem.
Senator Yaw, ignoring the heroin issue won't make it go away. So what advice do you have for local leaders? What can they do to help law enforcement and residents who are battling addiction?
That is a really broad question. I think number one has already been indicated here. The community has to recognize that they have a problem. There are so many communities that know it's like we talked about initially. No, we don't have the problem in our community. That's somebody else's issue. Well, it's everywhere. I think that's one of the things. The other thing that we can do, and it's interesting, in our hearings, we actually ran across significant pushback from various agencies about the use of naloxone. And I applaud the fact that the Pennsylvania State Police have taken a leadership role in carrying it, not afraid to use it, and to help save lives. As one person that we had testified at one of our hearings, in order to treat somebody, they have to be alive. So you have to make that initial decision. And if they can save lives, especially in my area of the state where it's very rural, more likely than not, the Pennsylvania State Police are going to be the first people on the scene. So that's really great that they're doing that and being a leader in that. The other thing I think that communities can do is have to understand we've got to get everybody together. And when I say everybody, all the law enforcement people that I have talked to in the course of our hearings have said we cannot arrest our way out of the problem. We can't just keep putting people in jail. Here's a real simple example that I use all the time. If you have diabetes, you don't send somebody away for 30 days and they come back and they're fixed. The same thing with the drug addiction. You can't send them away. It's a lifelong problem, and it's something that the community is going to have to face. So what communities can do, they have to understand, it takes everybody involved. It takes law enforcement, it takes the courts, it takes hospitals, it takes doctors, schools. And one very, very important area that we repeatedly came across is it takes a faith-based element too. That's very important. And you probably heard terms like warm handoff and that. Well, this is a progression that you need to be able to take care of a person not only when they've been treated for an addiction, but then what's the next step? You have to encourage them to stay clean, and that's why it's so important to have that part of the community effort.
Barbara, as someone on the front lines at the local level, what advice do you have for fellow township officials? How can they be part of the solution?
Well, as the local leader, I think you need to go to the source of all information about what's happening in your community, and I think that would begin with the police or your law enforcement services, whether it be someone like Trooper Reed or your regional police department. And my police department, we have a very active and very involved group, especially Detective Breslau, who is on top of the information, what's happening where. Get those facts, and because you need to know what the extent of the problem is. And then you need to convince your residents what the extent of the problem is. And then find the resources that are already available in your community, organize them, and put them on whatever mechanism you have for communication. Get that information out. Look, folks, we have a problem. 2, here's where you can go for help. And communicate that and stay on top of it. And you recognize that that is a mandate for local government, for you being in charge of getting that information. You're closest to the people. And at the very least, if you take on that mandate or not, do whatever you can to change the notion that addiction is some kind of problem with your character or some kind of weakness in the human spirit. It is not. It is a disease. It is a failure of a brain chemistry. And it requires the treatment, care, consideration that any other disease requires. So that's what I say is local government, start there if you don't start anywhere.
I want to thank everyone for participating and tuning in, but before we wrap up, I'd like to ask each of our panelists for any closing remarks. Barbara Lyons, any thoughts?
We're happy to help. Anybody who wants to reach us, dawstownpa.org. We have helpful links on our website, and you can reach me through there. We're happy to help structure any kind of communication system you want in your community.
Okay. Senator Yaw?
Yes, as the chairman of the board of the Center for Rural Pennsylvania, that's on the center's website is where you will find the report that I referred to on heroin. And also, if somebody is interested and really wants to get an education on the heroin problem in Pennsylvania, I have about 30 hours worth of presentations on my website of all the 7 hearings that we've been involved in. So there's a real source of information if you want to really get down into the nitty-gritty of it.
Great. Thanks. Trooper Reed, final thoughts?
Well, as we saw here today, law enforcement is a portion of the fight against heroin, but it's a combined effort between our citizens and our community leaders here. So that's important moving forward. If you want more information on our end of it, you can visit our website at psp.pa.gov.
Well, that's all we have time for this special report. I'd like to thank our panelists for this insightful discussion. More detailed reporting on Pennsylvania's heroin epidemic will be featured in the January 2016 edition of the Township News magazine. Also, if you're addicted or know someone who is, help is available from the State Department of Drug and Alcohol Programs. Visit the agency's website at ddap.pa.gov or call 717-783-8200 for information, including a directory of drug and alcohol treatment providers. As always, we'd love to hear feedback on today's report. Contact Jill Ercolino, our producer for TVN, at jercolino@psats.org or call 717-763-0930, extension 125, with your comments. From all of us here at PSATS, I'm Dave Sanko. Thanks for watching.